Diabetes is a persistent ailment that affects millions of individuals all over the world, and the prevalence of this condition is increasing more and more. The International Diabetes Federation estimates that there were around 463 million adults living with diabetes, and it is anticipated that this figure will dramatically increase to 700 million by the year 2045. Recognizing the early signs and symptoms of diabetes is essential for effectively managing and intervening in the disease at the appropriate time. In this video, we will investigate 10 concerning warning signs of diabetes that persons ought to be conscious of in order to guarantee early identification and avoidance practices. Number 10. Frequent urination. Diabetes is characterized by a number of symptoms, one of the most prominent of which is an increased frequency of urine, particularly throughout the night. The reason for this is that the body makes an effort to remove excess glucose through the medium of urine. An increased amount of urine is the result of the kidneys working harder than usual to filter and eliminate the excess sugar. In the event that you realize that you are going to the restroom more frequently than you normally would, this is a warning sign that requires your attention. Number 9. Excessive thirst. There is a correlation between frequent urination and excessive thirst. As a result of the increased fluid loss through urine, individuals experience a feeling of dehydration, which compels them to consume a greater quantity of water. It is possible that diabetes is the cause of an increase in thirst that you have not been able to explain. Number 8. Weight loss. Rapid and unexplained weight loss can be a warning sign of diabetes, particularly in those who have type 1 diabetes. This is especially true in people who have lost weight without any apparent reason. When the body is unable to make effective use of glucose, it starts to break down things like muscle and fat in order to get energy. It is imperative that you seek the advice of a medical professional if you suffer a large loss of weight without making any modifications to your diet or exercise routine. Number 7. Increased hunger. Despite the fact that they have lost weight, those who have diabetes may still notice an increase in their hunger levels. Because the body is unable to make efficient use of glucose, it suffers from a deficiency of energy, which in turn causes continuous feelings of hunger. If you notice that you have a persistent desire for food even after you have eaten, this could be a sign that you will develop diabetes. Number 6. Fatigue and weakness. Diabetes can produce weariness and weakness because the body is unable to turn glucose into energy in an efficient manner. One of the symptoms of exhaustion is the inability of cells to acquire an adequate quantity of glucose. If you have unrelenting fatigue, even after getting an adequate amount of rest, it is imperative that you take diabetes into consideration as a possible cause. Number 5. Blurred vision. Blurred vision can be a notable symptom that signals the onset or progression of diabetes. This visual impairment is often an early warning sign that the condition is developing, and it is crucial to recognize and address it promptly. The link between diabetes and blurred vision is primarily attributed to the impact of high blood sugar levels on the eyes. Elevated levels of glucose in the bloodstream can disrupt the delicate fluid balance within the eyes. One of the key consequences is the swelling of the lens, a condition known as diabetic retinopathy. The lens swelling can lead to changes in the shape of the lens and consequently result in blurred or distorted vision. The severity of vision impairment can vary, ranging from mild blurriness to significant visual disturbances. Number 4. Slow healing of wounds. Individuals who have diabetes may observe that cuts, bruises, or wounds take longer to heal than those who do not have an underlying medical condition. Blood sugar levels that are too high can hinder the body's capacity to repair damaged tissues and respond effectively to infections. Should you notice a delay in the healing of wounds or a recurrence of infections, this may be an indication that you have diabetes. Number 3. Numbness or tingling in extremities. The condition known as peripheral neuropathy, which is a common complication of diabetes, can result in numbness or tingling in the extremities. This condition can affect both the hands and the feet. Over a prolonged length of time, elevated blood sugar levels can cause nerve damage, which might result in the symptoms described to you. If you are experiencing tingling or numbness that does not go away, it is imperative that you seek the advice of a medical professional in order to receive a comprehensive evaluation. Number 2. Recurrent infections. People who have diabetes typically have a compromised immune system, which makes them more likely to experience recurring infections. This makes them more susceptible to infections. It is possible that the uncontrolled nature of diabetes can be a substantial contributor to the recurrence of infections, with a particular emphasis on disorders such as skin infections and urinary tract infections. A diligent monitoring of infection frequency and quick action for the treatment of infections are both necessary components of optimal diabetic management. Individuals who have diabetes may be more susceptible to infections, and the influence that uncontrolled diabetes has on the immune system further exacerbates this vulnerability. Therefore, it is essential that there be continuous monitoring of these individuals. As a result, it is essential to take preventative steps in order to address and cure infections as soon as possible in order to effectively control diabetes overall. Number 1. Dark patches on the skin. Acanthosis nigricans is a dermatological condition that presents as dark, thick, velvety patches on the skin. These patches are often indicative of an underlying health issue with a significant association to insulin resistance, a key factor in the development of type 2 diabetes. Recognizing and understanding the implications of these dark patches is crucial for early detection and management of potential health concerns. The manifestation of acanthosis nigricans typically occurs in areas where the skin folds or creases, such as the neck, armpits, and groin. The skin changes may start as subtle discoloration and progress to more pronounced velvety textures. The darkened patches may also extend to other areas, such as the elbows, knees, and hands. It's important to note that while acanthosis nigricans is often linked to insulin resistance and diabetes, it can also be associated with other conditions or factors, such as obesity, hormonal disorders, and certain medications. Insulin resistance is a condition in which the body's cells become less responsive to the effects of insulin, leading to elevated levels of glucose in the bloodstream. This, in turn, can contribute to the development of type 2 diabetes. Acanthosis nigricans serves as a visible marker for insulin resistance, making it a valuable early warning sign for individuals at risk of metabolic disorders. If you observe dark patches on your skin, especially in the characteristic areas associated with acanthosis nigricans, it is imperative to consult with a medical professional promptly. A healthcare provider, such as a dermatologist or endocrinologist, can conduct a thorough evaluation to determine the underlying cause of the skin changes and assess your overall health. Diagnostic tests may include blood glucose measurements, insulin levels, and other relevant assessments to identify potential risk factors or existing health conditions. Early intervention is crucial in managing insulin resistance and preventing the progression to type 2 diabetes. Lifestyle modifications, such as adopting a healthy diet, engaging in regular physical activity, and maintaining a healthy weight are often recommended. In some cases, medication or other medical interventions may be necessary. It is of the utmost importance to recognize diabetes at an early stage in order to effectively manage the condition and prevent complications. It is possible to make a substantial impact in the management of the illness and the improvement of general well-being by recognizing the warning signs and getting medical assistance at the appropriate time. If you or someone you know is suffering any of the symptoms listed above, you should not ignore them. Instead, you should seek the advice of a healthcare expert in order to receive an accurate diagnosis and appropriate management advice for diabetes. It is important to keep in mind that education and awareness are significant instruments in the fight against diabetes, and that early intervention can lead to a life that is healthier and more rewarding. What do you think of our video? Let me know in the comment section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.